Have you ever been there? You wake up at 2 a.m., then again at 4 a.m., just to pee. According to the data, your PSA is rising. We'll monitor it further. But you don't want to just monitor, you want to do it. Then you hear about zinc. Someone shared that taking zinc every day can help lower PSA, improve nocturia. But how long does it take to work? How long does it take to know if you're responding well? The truth is, if you expect results in the first week, you'll give up sooner. Your body doesn't respond immediately. It doesn't go through clear stages, and understanding these stages will help you not only show your arms, but also act in the right way. Dr. Claire Monroe, Men Over 50. Today, I will guide you through the 5 basic stages of zinc supplementation for 30 days, especially for men with high PSA or prostate problems. Phase 1, days 1 to 3, the silent loading phase. This is the stage that most people give up on most easily, because you don't see anything happening. No reduction in PSA, no improvement in nocturia, no change in perspective. And that's completely normal. According to mineral readiness clinical studies in men over 50, the first 3 days are called the loading phase. Your body is like an empty fuel tank. The paint is just starting to be absorbed through the digestive system, entering the bloodstream and recharging the lack of light in the tissues. This phase doesn't produce an immediate effect, it just fills the tank. An important note, if you take zinc on an empty stomach, you may feel a little nauseous. This is a common reaction, nothing to worry about, and will lessen if you take it after a meal. Backhand index pointing right, the goal of phase 1 is 1. Test your ability to handle the service. If there are no serious side effects, continue to phase 2, where the body begins to respond. Phase 2, days 4 to 7, your body starts to respond. If you've made it through the first 3 days without nausea, dizziness, or any other discomfort, congratulations. You've entered phase 2, and this is when your body starts to talk to you again. But not with PSA, not with test results, but with your sense of taste and smell. Your sense of taste returns, a small but very important sign. You might be surprised. Today's meal seems richer. Your morning cup of coffee tastes much better than yesterday. The fruit you eat every day suddenly tastes sweeter. Really? Why? Because zinc directly affects the cells that sense taste and smell. If you've ever felt like your food is bland, your coffee is as bland as water. It could be a sign of a long-term zinc deficiency. And now, after 4 to 7 days, those cells are starting to heal. This is the first sign that your body is absorbing the zinc and responding well. Energy is back. Not energized. Not like drinking strong coffee, but less tired. Not as sleepy in the afternoon as the past few days. Not as lazy to get out of bed. This is something that many men over 50 have shared with me. They say, I don't think I'm tired until suddenly I feel less tired. You don't need to feel like you're 30 again. Just less tired. A little more alert. And that's a sign that zinc is working in you. So what should you pay attention to at this stage? Taste. Does your food taste better? Does the smell of coffee become more pronounced? Energy tracking. Feeling less sluggish in the afternoon? Feeling a little more inspired? Write it down in a notebook or checklist. Even just 1 line is fine. Day 5, coffee tastes good again. Day 6, less sleepy after lunch. You're starting to hear the voice inside. And if you hear it clearly, keep going. The upcoming phase 3 is when your immune system speaks. Stage 3, days 8 to 14, the quiet immune shift. You've made it through the first week. You noticed your food tastes better. Maybe you feel a little more awake during the day. That's good. That means your body is responding. Now we enter week 2, a stage most men don't feel directly, but it's happening underneath the surface. Your immune system is starting to shift. So what's going on inside your body? At this stage, zinc has been in your system for over a week. It's already helping your white blood cells, the soldiers of your immune system, work better. Studies show zinc improves their ability to find and fight inflammation. You may not feel this. You might not notice anything obvious, but something is happening quietly. You might not catch the cold your wife has. A small cut on your hand may heal faster. You may feel just a little more resilient than usual. It's subtle, but it matters. This is also when inflammation markers in your body, things that silently drive up PSA. Begin to shift in the right direction. What not to expect yet. You probably won't see any big change in your PSA yet. Most men don't. And that's okay. The prostate is slow to respond. It needs time to soak up enough zinc to function better. That's why many men give up at this point too soon. They think, it's been 2 weeks and nothing's changed. But the real shift? It often starts next week in stage 4. What to watch for in stage 3? You feel a bit more resilient, physically and mentally. You didn't get that cold going around. Minor cuts or bruises heal faster. Less afternoon fog or fatigue. These are small signs, but they mean progress. And if you've noticed any of these, that's a good sign you're on the right track. Backhand index pointing right quick check-in. Have you made it to day 10? If yes, drop the simple 1 in the comments. That tells me you're still here, still trying, still showing up for your health. You don't have to write a long message. Just type 1 if you've made it this far. It means something. To you. To me. To other men reading this, looking for a reason to keep going. Welcome to week 3. If you've made it this far, you're doing better than most. And here's the exciting part. This is the week where real changes often begin. For many men who respond well to zinc, this is the turning point. The moment the inside starts to show on the outside. So, what changes might you notice now? Let's start with your PSA. By now, your prostate has had about 2 weeks to build up zinc levels inside the tissue. Research shows this is when prostate cells begin functioning differently. Inflammation may start to go down. And for some men, PSA begins to drop. It's usually not a huge drop, not 3 points overnight, but many men report a drop of 0.3 to 0.7 points this week, a total drop of 1.0 or more by day 30. And if that's you, that's big. That's progress. You might also feel it in your daily life. You wake up 1 less time at night to pee. Your stream might feel a bit stronger. There's a little less urgency during the day. Nothing dramatic, but enough that you pause and think, wait, I think this is getting better. That's stage 4. Why this week matters most. Here's something many men don't know. If you're going to respond to zinc, you'll usually see it by day 21. That doesn't mean full results yet, but it means the process is working. If you've noticed, white heavy checkmark taste improvement, white heavy checkmark more steady energy, white heavy checkmark better healing or immunity, white heavy checkmark slight PSA or symptom changes, then your body is saying yes, this is helping. If you haven't noticed any of that yet, it might mean zinc isn't the solution for you. And that's okay, there are other tools to try. But if you're seeing signs, stay with it. You're entering the final phase next, the one that locks in the gains. If this series has helped you so far and you'd like to follow the next stages, feel free to hit the subscribe button. There's no pressure, no big pop-ups, just quiet, real info that respects your time and your health. Let me know in the comments. Are you seeing any PSA changes yet? Even half a point matters. Even 1 less trip to the bathroom at night is a win. You're doing this 1 day at a time. If you've made it here, day 22 or beyond, you've done something most men never do. You stuck with the process. You gave your body a real chance to respond. And now, we see where it all leads. This final week is what I call the plateau and stabilize phase. Here's what's likely happening now. Your zinc levels are no longer climbing. They're leveling out. Your body has absorbed what it needs. Your prostate tissue is no longer catching up. It's working with what it has. This is where your PSA, if it's going to improve, finishes its drop. Most men see their best PSA changes between days 18 and 30. Here's what studies have shown. If you respond well, your total PSA drop may reach 1.0 to 2.0 points. Some men drop even more, 2.5 to 3.5, especially if they were low in zinc to begin with. Others see smaller changes, and that's okay too. You may also feel steadier symptoms. Fewer nighttime wake-ups. Stronger, smoother urine stream. Less pelvic pressure or urgency. Nothing drastic. Just calmer. That's the key word here. Stability. But here's something important. Taking more zinc after this point won't help more. If 25 to 30 milligrams helped you get here, jumping to 50 or 100 milligrams won't double your results. In fact, it could cause new problems: nausea, copper deficiency, weakness, or brain fog. Your body has what it needs now. The question is, how will you keep it steady? 3 options after day 30. White heavy checkmark option 1, continue, but with balance. Stay on 25 to 30 milligrams daily with added copper to avoid imbalance. Check with your doctor every 3 months, PSA, zinc, and copper. White heavy checkmark option 2, cycle it. Try 30 days on, 30 days off. Let your body reset. Still track symptoms and PSA with your doctor. White heavy checkmark option 3, switch to food-based zinc. Oysters once a week. Pumpkin seeds daily. Grass-fed beef 1, 2x per week. Let food do the maintenance now. Directed summary: what to look for by day 30. PSA drop of 1.0 or more. Fewer trips to the bathroom. No side effects. Energy and mood slightly better. If that's you, zinc worked. Not magic, but real, steady progress. Backhand index pointing out if you've seen any improvement, big or small. Drop a quick comment and tell me. Still going strong. That tells me this helped you, and it helps other men feel less alone in the process. If you'd like the tracking guide for the full 30 days, just comment PSH30 and I'll send it your way. And if you haven't yet, feel free to subscribe so you don't miss the next video. What happens when you take zinc for 3 months? Is it safe? You've done the work. Now let's make sure it lasts. If you're reading this and you've stuck with zinc for the full 30 days, you've done something powerful. You didn't quit early. You paid attention to your body, and you gave your prostate a chance to heal in its own time. Whether your PSA dropped a lot, a little, or not at all, you now have real data. You now know what your body does with zinc. That's knowledge you can carry forward into future choices, future checkups, and future years. As a health educator working with men over 50, I've seen this over and over. It's not the magic pill that changes things. It's the steady steps taken with patience that help you sleep better, feel stronger, and worry less about that PSA number. If zinc helped you even just a little, that's progress. If it didn't, it's still progress because now you know. So here's what I suggest. Share your experience below. Even just writing, still going strong, Dr. Claire lets me know you're here. And it helps other men feel supported. If you haven't already, feel free to subscribe to this channel. You'll get quiet, practical support, no hype, no pressure, just science and steady help. And if you want the Zinc 30 checklist to track your own progress, just comment Zinc 30. I'll send you the free printable so you can stick it on your fridge or bring it to your doctor. Man walking, what's next? In the next video, we'll explore what happens when you take zinc for 3 months. We'll talk about long-term safety, copper balance, and when to stop or switch to food-based options. Until then, stay steady, stay informed, and remember, your best years aren't behind you. With respect, Dr. Claire Monroe. For men over 50, walking this road with strength and clarity, just comment PSH30 and I'll send it your way. And if you haven't yet, feel free to subscribe so you don't miss the next video. What happens when you take zinc for 3 months? Is it safe? You've done the work. Now let's make sure it lasts. If you're reading this and you've stuck with zinc for the full 30 days, you've done something powerful. You didn't quit early. You paid attention to your body, and you gave your prostate a chance to heal in its own time. Whether your PSA dropped a lot, a little, or not at all, you now have real data. You now know what your body does with zinc.